2. Antioxidants. Walnuts contain antioxidants, which help combat oxidative stress in the body. This can be particularly beneficial for mental health, as oxidative stress has been linked to various mood disorders. 3. Mood regulation. Certain compounds in walnuts, like polyphenols, may play a role in regulating mood and reducing symptoms of anxiety and depression, which can co-occur with PTSD. 4. Nutritional support. A balanced diet, including walnuts, can contribute to overall physical health, which is important for mental well-being. Walnuts may benefit individuals with post-traumatic stress disorder, PTSD, for several reasons. 1. Omega-3 fatty acids. Walnuts are a rich source of omega-3 fatty acids, which have been shown to support brain health and reduce inflammation. Some studies suggest that omega-3s can help improve mood and cognitive function. Several types of medications can help manage symptoms of post-traumatic stress disorder, PTSD. Here are some commonly prescribed options. 1. Selective serotonin reuptake inhibitors, SSRIs. These are often the first-line treatment for PTSD. Examples include sertraline, Zoloft, paroxetine Paxil. 2. Serotonin norepinephrine reuptake inhibitors, SNRIs. These may also be effective in treating PTSD symptoms. Examples include venlafaxine, Effexor XR. 3. Prazosin. This medication is sometimes used to help reduce nightmares associated with PTSD. 4. Antidepressants. Other types of antidepressants may be prescribed based on individual needs. 5. Anti-anxiety medications. While not a first-line treatment for PTSD, medications, such as benzodiazepines, may be prescribed for short-term relief of anxiety symptoms. 4. Stimulants. Medications like methylphenidate, Ritalin, or amphetamines may be used to help with attention and focus issues. 5. Cognitive enhancers. Sometimes, medications like donepezil, Aricept, are considered for cognitive rehabilitation, although this is more common in cases of severe brain injury. 6. Muscle relaxants. For muscle spasticity or tension, medications, such as baclofen or tizanidine may be used. 7. Antipsychotics. In some cases, atypical antipsychotics may be prescribed for severe agitation or behavioral issues. 8. Neuroprotective agents. While still under research, certain agents like progesterone have been investigated for their potential to reduce secondary brain injury. It's essential to work closely with a healthcare provider to determine the most appropriate medication plan based on the individual's condition, symptoms, and medical history. Rehabilitation therapies, such as physical, occupational, and speech therapy, are also crucial components of recovery following a TBI. While walnuts can be a healthy addition to a diet, they should not replace professional treatment for PTSD. Always consult with a healthcare provider for appropriate care and management. Medications for managing symptoms and complications associated with traumatic brain injury, TBI, vary based on the specific symptoms and needs of the patient. Here are some commonly used categories of medications. 1. Analgesics. To manage pain, over-the-counter options like acetaminophen or nonsteroidal anti-inflammatory drugs, NSAIDs, may be used. For more severe pain, prescription opioids might be necessary. 2. Anticonvulsants. These are prescribed to prevent or manage seizures, which can occur after a TBI. Common options include phenytoin, dilantin, levetiracetam, Keppra, carbamazepine, Tegretol. 3. Antidepressants. To address mood disorders, anxiety, and depression that may follow a TBI. SSRIs like sertraline, Zoloft, or fluoxetine, Prozac, are commonly prescribed. 6. Antipsychotics. In some cases, atypical antipsychotics may be used to help manage severe symptoms. 7. Mood stabilizers. These may be prescribed if mood regulation is a concern. Always consult with a healthcare provider to determine the most appropriate treatment based on individual circumstances and health history. Therapy, such as cognitive behavioral therapy (CBT), is also an important component of PTSD treatment. Someone has experienced a traumatic brain injury, TBI. If someone has experienced a traumatic brain injury, TBI, but is unsure of their symptoms, it's important to take the following steps for assessment and treatment. 1. Seek medical attention. The first step is to consult a healthcare professional. A thorough evaluation, including a physical examination and possibly imaging studies, like a CT scan or MRI, can help identify the extent of the injury. 2. Observation. Even if symptoms are not immediately apparent, healthcare providers may recommend monitoring the individual for a period to watch for changes in behavior, cognition, or physical condition. 3. Rest and recovery. Regardless of symptom awareness, initial management typically involves physical and cognitive rest. This helps prevent further injury and allows the brain to heal. 4. Symptom management. If any symptoms develop, like headaches, dizziness, or mood changes, the healthcare provider may recommend appropriate medications or therapies to manage these symptoms. 5. Rehabilitation. Engaging in rehabilitation therapies, physical, occupational, speech therapy, can help improve recovery and address any cognitive or physical impairments that may arise as the individual begins to understand their symptoms better. 6. Gradual return to activities. Once a healthcare provider has assessed the situation, a gradual return to normal activities may be advised, ensuring that the individual does not push themselves too hard. 7. Education. Learning about TBI and potential symptoms can help individuals recognize changes in their condition over time. This knowledge can aid in timely intervention if new symptoms arise. If symptoms develop later or worsen, it's crucial to report these changes to a healthcare provider promptly for further evaluation and treatment. Treating traumatic brain injury. TBI without medication focuses on non-pharmacological approaches to promote recovery and manage symptoms. Here are several strategies. 1. Rest and recovery. Ensure plenty of physical and cognitive rest initially, allowing the brain to heal. Avoid activities that require intense concentration or physical exertion. 2. Cognitive rehabilitation. Engage in cognitive rehabilitation therapy, which involves working with a therapist to improve cognitive skills like memory, attention, and problem solving. 3. Physical therapy. Physical therapy can help improve mobility, strength, and coordination, addressing any physical limitations resulting from the injury. 4. Occupational therapy. This therapy helps individuals regain skills needed for daily living and work, focusing on improving independence. 9. Routine. Establishing a structured daily routine can help with cognitive organization and provide a sense of normalcy. 10. Gradual return to activities. Gradually reintroduce daily activities, ensuring to monitor for any worsening symptoms. While these approaches can be effective, it's important to work closely with healthcare professionals to tailor a recovery plan based on individual needs and circumstances. Regular follow-ups are essential to monitor progress and make necessary adjustments to the treatment plan. Eating a balanced and nutritious diet can support recovery from traumatic brain injury, TBI, and promote overall brain health. Here are some foods that are particularly beneficial. 1. Fatty fish. Rich in omega-3 fatty acids, which are essential for brain health. Examples include salmon, mackerel, sardines, and trout. 2. Nuts and seeds. Walnuts, flax seeds, and chia seeds are good sources of omega-3s and antioxidants. 3. Berries. Blueberries, strawberries, and other berries are high in antioxidants, which can help reduce inflammation and oxidative stress. 4. Leafy greens. Spinach, kale, and other greens are rich in vitamins, minerals, and antioxidants that support cognitive function. 5. Whole grains. Foods like brown rice, quinoa, oats, and whole grain bread provide complex carbohydrates and fiber, promoting steady energy levels and brain function. Five. Speech therapy. If communication or swallowing is affected, speech-language therapy can be beneficial in regaining these skills. 6. Lifestyle modifications. Implementing a healthy lifestyle can aid recovery. Nutrition. A balanced diet rich in fruits, vegetables, whole grains, and omega-3 fatty acids supports brain health. Hydration. Staying well hydrated is important for overall health and recovery. Sleep. Prioritize quality sleep to promote healing. 7. Stress management. Techniques such as mindfulness, meditation, or yoga can help reduce stress and improve overall well-being. 8. Social support. Engaging with family and friends for emotional support can aid recovery. Support groups for TBI survivors may also provide community and understanding. 9. Routine. Establishing a structured daily routine can help with cognitive organization and provide a sense of normalcy. 10. Gradual return to activities. Gradually rare. Duce daily activities, ensuring to core for any worsening. Incorporating these foods into a balanced diet can aid recovery and support overall brain health. It's also important to stay well hydrated and limit processed foods, sugars, and saturated fats. Always consult with a healthcare provider or nutritionist for personalized dietary recommendations, especially after TBI. If you're looking to recover from COVID-19 and help your body clear the virus, here are some general recommendations. 1. Rest and recovery. Allow your body ample time to rest and heal. Sleep is essential for recovery. 2. Stay hydrated. Drink plenty of fluids, such as water, herbal teas, and broths, to stay hydrated and help your body flush out toxins. 6. Lean proteins. Sources like chicken, turkey, beans, and legumes provide the amino acids needed for neurotransmitter production and overall brain function. 7. Avocado. This fruit contains healthy fats that can support brain health and improve blood flow. 8. Dark chocolate. In moderation, dark chocolate with high cocoa content can provide antioxidants and improve mood. 9. Turmeric. Curcumin, the active compound in turmeric, has anti-inflammatory properties that may benefit brain health. 10. Green tea, rich in antioxidants and compounds that may support brain health and improve cognitive function. 11. Citrus fruits. Oranges, grapefruits, and lemons are high in vitamin C, which supports overall health and may help in brain recovery. 12. Eggs, a good source of choline, which is important for brain development and function. 3. Balanced nutrition. Eat a diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. Nutrient-dense foods can support your immune system and overall recovery. 4. Manage symptoms. Use over-the-counter medications, as needed, to manage symptoms like fever or pain. Always follow the guidance of a healthcare provider. 5. Breathing exercises. If you experience respiratory symptoms, gentle breathing exercises or techniques like deep breathing can help improve lung function. 6. Gradual activity. Once you're feeling better, gradually return to physical activity as tolerated. This can help improve lung capacity and overall strength. 7. Follow medical guidance. If you have persistent symptoms or concerns, consult with a healthcare professional for personalized advice and treatment options. 8. Supportive therapies. Some people may benefit from therapies such as physical therapy, occupational therapy, or respiratory therapy, especially if they experience lingering effects. 9. Mindfulness and stress management. Practicing mindfulness, meditation, or other relaxation techniques can help reduce stress and support overall well-being during recovery. 10. Avoid alcohol and smoking. These can impair immune function and delay recovery, so it's best to avoid them during this time. While most people recover from COVID-19 at home, severe cases may require medical attention. Always consult with a healthcare provider for guidance tailored to your specific situation. If you've received the Moderna COVID-19 vaccine, or any vaccine, the body naturally processes and eliminates vaccine components over time. Here are some ways to support your body's natural detoxification processes. 1. Stay hydrated. Drink plenty of water to help flush out toxins and support overall bodily functions. 2. Eat a balanced diet. Focus on whole foods, including fruits, vegetables, whole grains, and lean proteins. Foods high in antioxidants, such as berries and leafy greens, can support detoxification. 3. Get plenty of rest. Sleep is crucial for recovery and overall health. Aim for quality sleep to help your body heal and rejuvenate. 4. Engage in regular exercise. Physical activity can boost circulation, improve lymphatic drainage, and enhance overall well-being. 5. Practice deep breathing. Breathing exercises can help improve lung function and promote relaxation. The Moderna COVID-19 vaccine is an mRNA vaccine designed to help protect against the SARS-CoV-2 virus, which causes COVID-19. Here's how it works and some of the concerns associated with it. How the Moderna vaccine works. 1. mRNA technology. The vaccine contains messenger RNA, mRNA that instructs cells in the body to produce a harmless piece of the spike protein found on the surface of the SARS-CoV-2 virus. 2. Immune response. Once the spike protein is produced, the immune system recognizes it as foreign and begins to generate an immune response. This includes the production of antibodies and activation of T cells, which help fight the virus if the person is exposed in the future. 3. Protection. By teaching the immune system to recognize and respond to the virus, the vaccine helps prevent severe illness, hospitalization, and death from COVID-19. 5. Practice deep breathing. Breathing exercises can help improve lung function and promote relaxation. 6. Avoid processed foods and sugars. Minimize intake of processed foods, added sugars, and unhealthy fats, which can burden the body. 7. Limit alcohol and caffeine. These can dehydrate the body and may interfere with recovery. 8. Consider herbal teas. Some herbal teas, like dandelion or milk thistle, are thought to support liver health, but consult with a healthcare provider before trying any new supplements or herbs. 9. Stay informed. Follow any post-vaccination guidance provided by healthcare professionals regarding activity levels, side effects, and care. It's important to remember that vaccines work by stimulating the immune system, and most components are eliminated from the body naturally within a few days to weeks. If you have specific concerns or are experiencing unusual symptoms after vaccination, consult with a healthcare provider for personalized advice. Concerns about the Moderna vaccine. 1. Side effects. Common side effects include pain at the injection site, fatigue, headache, muscle pain, chills, fever, and nausea. These are generally mild to moderate and resolve within a few days. Some people may experience more significant side effects, but serious reactions are rare. 2. Myocarditis and pericarditis. There have been reports of myocarditis and pericarditis, inflammation of the heart or surrounding tissue, following mRNA vaccinations, particularly in younger males. These cases are rare and typically resolve with treatment. 3. Skepticism and misinformation. Some people may be hesitant about the vaccine due to misinformation or concerns about the speed of its development. However, extensive clinical trials and real-world data have shown the vaccine's safety and efficacy. 3. Skepticism and misinformation. Some people may be hesitant about the vaccine due to misinformation or concerns about the speed of its development. However, extensive clinical trials and real-world data have shown the vaccine's safety and efficacy. 4. Allergic reactions. Although rare, some individuals may experience severe allergic reactions, anaphylaxis, after vaccination. This is why monitoring after receiving the vaccine is recommended. Conclusion. While there are valid concerns regarding any vaccine, the benefits of the Moderna vaccine in preventing COVID-19, particularly severe illness and death, generally outweigh the risks for most individuals. It's essential to discuss any concerns with a healthcare provider, who can provide personalized information based on individual health history and risk factors. Vaccination remains a critical tool in controlling the spread of COVID-19 and reducing its impact on public health. The Moderna COVID-19 vaccine, like all vaccines, contains components that are processed and eliminated by the body naturally. The concept of toxins can sometimes be misunderstood in the context of vaccines. Here's how the body handles the vaccine and supports its own detoxification. Understanding vaccine components. 1. mRNA breakdown. The mRNA from the Moderna vaccine is broken down by the body's cellular machinery shortly after it has been used to produce the spike protein. This process occurs within a few days. 2. Immune response. The immune system generates antibodies and activates T cells in response to the spike protein. These components help protect against future infections, but do not remain in the body indefinitely. Supporting the body's natural detoxification. To support your body in processing and eliminating any vaccine components, as well as other substances, consider the following. 1. Stay hydrated. Drinking plenty of water helps maintain kidney function, which is essential for filtering waste from the blood. 2. Eat a healthy diet. Focus on a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. Foods high in antioxidants, like berries, can help support your immune system. 3. Get plenty of rest. Sleep is crucial for recovery and allows your body to heal and regenerate. 4. Exercise regularly. Physical activity helps improve circulation and supports the lymphatic system, which plays a role in detoxification. 4. Exercise regularly. Physical activity helps improve circulation and supports the lymphatic system, which plays a role in detoxification. 5. Limit alcohol and processed foods. Reducing intake of alcohol and highly processed foods can alleviate stress on the liver and improve overall health. 6. Avoid smoking. Smoking can introduce toxins into the body and impair the immune system. 7. Practice stress management. Techniques such as mindfulness, meditation, or yoga can support overall well-being. Conclusion. It's important to understand that vaccines like the Moderna shot are designed to be safe and effective, and any components introduced by the vaccine are naturally cleared from the body. If you have specific concerns about detoxification or your health after vaccination, it's best to consult with a healthcare professional for personalized guidance. The spike protein is a component of the SARS-CoV-2 virus, and while it plays a crucial role in viral infection, it's important to clarify that you don't want to make spike proteins in your body in a harmful sense. Instead, after vaccination with mRNA vaccines like Moderna, your body produces spike proteins temporarily to stimulate an immune response, which helps protect against COVID-19. To support your immune system and overall health, consider the following foods and nutrients. Foods to support immune health. 1. Fruits and vegetables, rich in vitamins, minerals, and antioxidants. Key options include, citrus fruits, oranges, lemons, and grapefruits, high in vitamin C, berries, blueberries, strawberries, and blackberries, high in antioxidants, leafy greens, spinach, kale, and Swiss chard, rich in vitamins A, C, and K. 2. Nuts and seeds, sources of healthy fats, vitamin E, and other nutrients, walnuts, rich in omega-3 fatty acids, almonds and sunflower seeds, high in vitamin E and antioxidants. 3. Lean proteins important for the production of immune cells, poultry, chicken, and turkey, fish, salmon, and mackerel, also high in omega-3 fatty acids, legumes, beans, lentils, and chickpeas, good sources of protein and fiber. 4. Whole grains, provide energy and fiber, oats, quinoa, and brown rice are excellent choices. 4. Whole grains, provide energy and fiber, oats, quinoa, and brown rice are excellent choices. 5. Fermented foods, support gut health, which is linked to immune function, yogurt, kefir, sauerkraut, and kimchi contain beneficial probiotics. 6. Healthy fats, support overall health and reduce inflammation, olive oil and avocados are great sources of monounsaturated fats. 7. Herbs and spices, many have anti-inflammatory and antioxidant properties, turmeric, contains curcumin, and ginger are particularly beneficial. Additional tips for immune support, stay hydrated, drinking plenty of water helps maintain overall health, get enough sleep, aim for 7 to 9 hours of quality sleep each night, exercise regularly, physical activity supports overall health and immune function, manage stress, chronic stress can impact immune function, so practices like mindfulness or yoga can be helpful. Conclusion. While the spike protein produced after vaccination plays a role in training your immune system, the best approach is to focus on overall health and nutrition to support your body's immune response. Always consult with a healthcare provider for personalized advice on nutrition and health, especially in the context of vaccination and immune support. To support your body in dealing with spike proteins, particularly after vaccination or exposure to the virus, focus on maintaining overall immune health and reducing inflammation. Here are some key nutrients and foods that can help. Nutrients and foods beneficial for immune support. 1. Vitamin C, an antioxidant that supports immune function and helps reduce inflammation. Sources: citrus fruits, oranges, lemons, strawberries, kiwi, bell peppers, broccoli. 2. Vitamin D, plays a crucial role in immune response. Sources: fatty fish, salmon, mackerel, fortified dairy products, egg yolks, and exposure to sunlight. 3. Zinc, essential for immune cell function, and may help reduce the duration of illness. Sources: meat, shellfish, legumes, seeds, pumpkin seeds, sunflower seeds, and nuts. 4. Omega-3 fatty acids help reduce inflammation and support overall immune health. Sources: fatty fish, salmon, sardines, flax seeds, chia seeds, and walnuts. 5. Antioxidant-rich foods help combat oxidative stress in the body. Sources: berries, dark chocolate, green tea, and artichokes. 6. Probiotics support gut health, which is closely linked to immune function. Sources: yogurt, kefir, sauerkraut, kimchi, and other fermented foods. 7. Turmeric contains curcumin, which has anti-inflammatory properties. Use in cooking or as a supplement. Consult a healthcare provider before taking supplements. 8. Garlic, known for its immune-boosting properties. Usage: incorporate fresh garlic into meals for added flavor and health benefits. General lifestyle tips. Stay hydrated. Adequate hydration supports overall health and immune function. Regular exercise. Physical activity can help enhance immune response and overall well-being. Get enough sleep. Quality sleep is essential for a well-functioning immune system. Manage stress. Chronic stress can negatively affect immune function, so practices like mindfulness and relaxation techniques can be beneficial. Conclusion: while there's no specific food that targets spike proteins directly, a well-balanced diet rich in these nutrients can support your immune system and overall health. Always consult with a healthcare provider for personalized advice, especially if you have specific health concerns or conditions. Spike proteins are a crucial part of how viruses, like SARS-CoV-2, infect cells. Understanding their role can clarify why they are important and when they can be problematic. What spike proteins are. 1. Role in infection. Spike proteins are found on the surface of the SARS-CoV-2 virus. They bind to receptors on human cells, facilitating viral entry and infection. 2. Vaccination and immune response. Vaccines like Moderna and Pfizer use mRNA technology to instruct cells to produce a harmless version of the spike protein. This triggers an immune response without causing disease, training the immune system to recognize and fight the virus if exposed later. When spike proteins can be problematic. 1. Viral infection. When the virus is present, the spike protein is associated with viral replication and disease. The spike protein can trigger inflammatory responses that contribute to symptoms and complications of COVID-19. 2. Autoimmune reactions. In some cases, the spike protein may lead to an exaggerated immune response or autoimmune reactions, where the immune system mistakenly attacks the body's own tissues. 3. Lingering effects. Some studies suggest that spike proteins may persist in the body after infection and contribute to long-term symptoms associated with long COVID, although more research is needed in this area. Why spike proteins are important. 1. Immune system training. Spike proteins are essential for the immune system to learn how to recognize and attack the virus effectively. Without the spike protein, the immune response would not be able to target the virus specifically. 2. Vaccine efficacy. The spike protein is the primary target of the immune response generated by COVID-19 vaccines, which helps prevent severe illness and death. Conclusion: while spike proteins can have negative effects when associated with active viral infection or certain immune responses, they are essential for developing immunity against COVID-19. Vaccines use spike proteins to safely educate the immune system, making them a critical component of effective vaccination strategies. Understanding the balance between their role in infection and immunity is key to addressing concerns related to COVID-19 and its variants. If you have further questions or concerns, consulting with a healthcare professional can provide personalized insights. The Moderna COVID-19 vaccine is designed to stimulate an immune response against the virus that causes COVID-19. Here's what you need to know about potential mood changes and its effects on the brain. Effects on neurons and the brain. 1. Immune response. The vaccine works by training the immune system to recognize the spike protein of the virus, not by affecting neurons directly. It does not contain live virus and does not alter brain function. 2. Neuroprotective effects. Some research suggests that vaccination may have protective effects on brain health by preventing severe COVID-19, which can lead to neurological complications. 3. No evidence of long-term harm. Current evidence does not support the idea that the Moderna vaccine harms neurons or brain function. Most people do not experience long-term cognitive effects from the vaccine. Vaccination and mood changes. 1. Common side effects. Some people report feeling fatigued, achy, or having mild flu-like symptoms after receiving the vaccine. These side effects can sometimes affect mood temporarily, but are typically short-lived. 2. Emotional responses. Anxiety about vaccination, potential side effects, or the ongoing pandemic can contribute to feelings of sadness or depression in some individuals. This is often situational rather than a direct effect of the vaccine itself. 3. Research findings. Studies on mRNA vaccines, including Moderna, have generally not found a direct causal link between vaccination and long-term depression or significant mood changes. The benefits of vaccination in preventing severe illness, hospitalization, and death usually outweigh the temporary side effects. Conclusion. While temporary feelings of fatigue or anxiety may occur after vaccination, these are generally short-lived and not indicative of lasting depression or negative effects on brain health. If you have concerns about mood changes or mental health after vaccination, it's important to speak with a healthcare professional for personalized guidance and support. They can help address any worries you may have and provide strategies for managing anxiety or depressive symptoms if they arise. Ensuring that neurons in your brain function optimally involves several lifestyle choices and practices that promote overall brain health and effective neural communication. Here are some key strategies. 1. Maintain a healthy diet. Omega-3 fatty acids, found in fatty fish, like salmon and mackerel, flax seeds, and walnuts. These are essential for maintaining healthy brain function. Antioxidant-rich foods, berries, dark chocolate, and leafy greens help reduce oxidative stress and inflammation in the brain. Whole grains, foods like brown rice, quinoa, and oats provide a steady supply of glucose, which is crucial for brain energy. 2. Stay hydrated. Drink enough water throughout the day to support cognitive function and overall brain health. 3. Regular physical exercise. Engaging in aerobic exercise increases blood flow to the brain, stimulates the growth of new neurons, and enhances neuroplasticity. 4. Mental stimulation. Challenge your brain with puzzles, learning new skills, reading, or playing musical instruments. Mental activities can help strengthen neural connections. 5. Get quality sleep. Aim for 7 to 9 hours of quality sleep each night. Sleep is vital for memory consolidation and overall cognitive function. 6. Manage stress. Chronic stress can negatively impact brain health. Techniques such as mindfulness, meditation, deep breathing, and yoga can help reduce stress levels. 7. Social interaction. Engaging in social activities and maintaining strong relationships can support cognitive health and emotional well-being. 8. Limit alcohol and avoid drugs. Excessive alcohol consumption and recreational drug use can impair brain function and negatively affect neurons. 9. Consider supplements if needed. Some supplements, like omega-3 fatty acids, vitamin D, and B vitamins, may support brain health. Consult a healthcare provider before starting any supplements. 10. Avoid toxins. Reduce exposure to environmental toxins, like heavy metals and pollutants, that can harm brain health. Conclusion. By adopting a healthy lifestyle that includes a balanced diet, regular exercise, mental challenges, and stress management, you can support the proper functioning of neurons and promote overall brain health. If you have specific concerns about brain health or cognitive function, it's best to consult with a healthcare professional for personalized advice. Removing a tooth yourself is generally not recommended, as it can lead to complications such as infection, excessive bleeding, or damage to surrounding teeth and gums. However, if you find yourself in a situation where you feel it's necessary, here are some guidelines to do so as safely as possible. Precautions before attempting to remove a tooth. 1. Consult a dentist. Always seek professional advice before attempting to remove a tooth. They can assess the situation and provide appropriate care. 2. Assess the tooth. ensure the tooth is already loose and ready to come out. If it's not loose, trying to remove it can cause pain and complications. Steps for safe tooth removal. If you decide to proceed, here are some steps to minimize pain and risk. 1. Gather supplies, clean, sterile tools, e.g., pliers or tweezers, gauze pads for bleeding, antiseptic mouthwash, pain relief medication if needed. 2. Choose the right time, pick a time when you can relax and won't be interrupted. 3. Wash your hands, ensure your hands and any tools are thoroughly clean to prevent infection. 4. Numb the area, rinse your mouth with an antiseptic mouthwash or apply a topical anesthetic gel to the area around the tooth to help numb it. 5. Wiggle the tooth, gently wiggle the tooth back and forth with your fingers to help loosen it further. To optimize brain function, it's essential to engage in a combination of lifestyle habits that promote cognitive health, improve memory, and enhance overall mental clarity. Here are several strategies to support and improve brain function. 1. Stay mentally active, challenge your brain, engage in puzzles, crosswords, Sudoku, or strategy games. Learning new skills or languages can also stimulate cognitive function, read regularly, reading books, articles, or academic papers keeps your mind engaged and enhances comprehension and vocabulary. Conclusion. While removing a loose tooth may seem straightforward, it's generally best to have a dentist handle the procedure to avoid complications. If you experience significant pain or have concerns about your teeth, consult a healthcare professional for guidance and care. 6. Use pliers if necessary, if the tooth is very loose, you can carefully use clean pliers or tweezers to grip the tooth firmly. Apply steady, gentle pressure to pull it out. 7. Remove the tooth, pull straight out with a quick motion, rather than twisting, to avoid breaking the tooth. 8. Control bleeding, once the tooth is out, place a piece of gauze over the socket and bite down to control bleeding. Change the gauze as needed. 9. Aftercare, rinse your mouth with warm salt water after a few hours to promote healing, avoid hard foods and smoking for a few days to prevent irritation. 10. Monitor for complications, watch for signs of infection, e.g., fever, increased swelling, pus, or excessive bleeding. If these occur, seek dental care immediately. 2. Maintain a balanced diet, eat brain-boosting foods, include foods rich in antioxidants, healthy fats, vitamins, and minerals. Focus on, fatty fish, rich in omega-3 fatty acids e.g., salmon, mackerel, fruits and vegetables, especially berries, leafy greens, and cruciferous vegetables, 2. Maintain a balanced diet, eat brain-boosting foods, include foods rich in antioxidants, healthy fats, vitamins, and minerals. Focus on, fatty fish, rich in omega-3 fatty acids e.g., salmon, mackerel, fruits and vegetables, especially berries, leafy greens, and cruciferous vegetables, nuts and seeds, provide healthy fats and nutrients like vitamin E, whole grains, supply steady energy for the brain. 3. Stay physically active, exercise regularly. Aerobic exercise increases blood flow to the brain, which can help improve cognitive function and stimulate the growth of new brain cells. 4. Get adequate sleep, prioritize sleep, aim for 7 to 9 hours of quality sleep each night. Sleep is crucial for memory consolidation and cognitive function. 5. Manage stress, practice mindfulness and relaxation techniques, engage in yoga, meditation, deep breathing, or Tai Chi to reduce stress, which can negatively impact cognitive function. 6. Stay socially engaged, maintain relationships. Regular social interaction can enhance mood and cognitive function. Join clubs, volunteer, or spend time with family and friends. 7. Limit alcohol and avoid drugs, reduce alcohol intake. Excessive alcohol consumption can impair cognitive function. Avoid recreational drugs that can harm brain health. 8. Stay hydrated, drink plenty of water. Proper hydration is essential for optimal brain function. Dehydration can lead to cognitive decline. 9. Consider supplements if needed, consult a healthcare provider. Some people may benefit from supplements like omega-3 fatty acids, B vitamins, or antioxidants. Always discuss with a healthcare professional before starting any new supplements. 10. Engage in continuous learning, lifelong learning. Take classes, attend workshops, or explore new hobbies to keep your brain engaged and adaptable. Conclusion: by incorporating these strategies into your daily routine, you can support and enhance brain function, improve cognitive health, and potentially reduce the risk of cognitive decline as you age. If you have specific concerns about cognitive function or brain health, consider consulting with a healthcare professional for personalized advice and assessments. 3. Establish routines and structure, create a daily schedule. Having a consistent routine can help reinforce memory by providing context and structure, use a planner. Write down important dates, tasks, and information to reinforce memory through repetition and review. 4. Stay physically active, regular exercise. Physical activity increases blood flow to the brain and promotes the growth of new brain cells, which can enhance memory. 5. Maintain a balanced diet, eat brain-healthy foods. Incorporate foods rich in antioxidants, omega-3 fatty acids, vitamins, and minerals. Focus on, fruits and vegetables, especially berries and leafy greens, fatty fish, salmon, mackerel, and sardines, nuts and seeds. Walnuts and flax seeds are beneficial for brain health. 6. Get quality sleep, prioritize sleep. Aim for 7 to 9 hours of quality sleep each night. Sleep is essential for memory consolidation and cognitive function. 7. Manage stress, practice relaxation techniques. Mindfulness, meditation, and deep breathing can help reduce stress, which can negatively impact memory. Improving memory and retrieving lost memories involves various strategies and practices that promote brain health and cognitive function. Here are some effective approaches to enhance your memory. 1. Stay mentally active, engage in cognitive exercises. Puzzles, crosswords, Sudoku, and memory games can help stimulate your brain and improve cognitive function. Learn new skills. Taking up a new hobby, learning a language, or playing a musical instrument can help strengthen neural connections. 2. Practice memory techniques, mnemonics. Use memory aids like acronyms, rhymes, or visualization techniques to help remember information. Chunking. Break down information into smaller, manageable chunks. For example, remembering a phone number as 3 separate groups. 8. Stay socially connected, engage with others. Regular social interaction can help keep your mind active and improve cognitive function. 9. Limit alcohol and avoid drugs, reduce alcohol consumption. Excessive alcohol intake can impair memory. Avoid recreational drugs that can harm brain health. 10. Consider cognitive behavioral strategies, memory training programs. Participating in structured memory training programs or cognitive rehabilitation can provide targeted strategies to improve memory. Conclusion: while it's normal to experience memory fluctuations, incorporating these strategies into your daily routine can help improve memory function and retrieval. If memory loss is significant or concerning, it's essential to consult with a healthcare professional for a comprehensive evaluation and personalized recommendations. 1. Consult healthcare professionals, therapists and counselors. Work with mental health professionals who specialize in trauma and brain injury to develop a personalized treatment plan. Neuropsychologists. Consider assessments to understand cognitive strengths and weaknesses and tailor interventions accordingly. 4. Maintain a healthy diet, nutrient-rich foods. Focus on a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. Key nutrients for brain health include, omega-3 fatty acids, found in fatty fish, flax seeds, and walnuts, antioxidants, berries, dark chocolate, and leafy greens can help reduce inflammation, B vitamins, important for brain health, found in whole grains, eggs, and green leafy vegetables. 5. Stay physically active, comma, regular exercise. Engage in regular physical activity to improve blood flow to the brain, support mood regulation, and enhance cognitive function. Aim for activities like walking, swimming, or gentle yoga. 2. Engage in cognitive rehabilitation, comma, cognitive therapy. Cognitive rehabilitation therapy can help improve cognitive skills such as memory, attention, and problem solving, comma, memory and attention training. Participate in exercises and activities designed to strengthen cognitive functions. 3. Practice mindfulness and relaxation techniques, comma, mindfulness meditation. Practices that promote mindfulness can help reduce anxiety and improve emotional regulation, comma, deep breathing and yoga. These techniques can help lower stress levels and enhance overall well-being. 6. Get adequate sleep, comma, prioritize sleep hygiene. Aim for 7 to 9 hours of quality sleep each night. Establish a calming bedtime routine and maintain a consistent sleep schedule to support recovery and cognitive function. 7. Limit alcohol and avoid drugs, comma, reduce alcohol consumption. Avoid excessive alcohol, as it can impair brain function and exacerbate PTSD symptoms. Stay away from recreational drugs that can harm mental health. 8. Engage in social activities, comma, stay connected, maintain social connections and engage in supportive communities to reduce feelings of isolation and promote emotional well-being. 9. Consider medication if needed, comma, consult a psychiatrist. Medication may be beneficial for managing symptoms of PTSD or depression. Discuss options with a healthcare provider to find the best approach. 10. Establish a routine, comma, daily structure. Create a daily routine that includes time for activities, self-care, and rest. Routines can provide stability and a sense of control. Conclusion. Recovery from PTSD and TBI takes time and effort, but by incorporating these strategies into your daily life, you can support your brain health and overall well-being. Working closely with healthcare professionals is essential for developing a comprehensive plan tailored to your specific needs and circumstances. Managing post-traumatic stress disorder, PTSD, and traumatic brain injury, TBI without medication involves a holistic approach that focuses on lifestyle changes, therapy, and supportive practices. Here are some effective strategies to help keep your brain healthy. 1. Therapeutic interventions, comma, cognitive behavioral therapy, CBT. This type of therapy can help address negative thought patterns associated with PTSD and improve coping mechanisms, comma, trauma-informed therapy. Seek therapists who specialize in trauma to guide you through recovery, comma, neurofeedback. This therapy trains you to regulate brain activity and can be beneficial for TBI and PTSD symptoms. 2. Mindfulness and relaxation techniques, comma, mindfulness meditation. Regular practice can help reduce anxiety, improve emotional regulation, and enhance overall mental clarity, comma, deep breathing exercises. Techniques like diaphragmatic breathing can help calm the nervous system and reduce stress, comma, yoga and Tai Chi. These practices combine physical movement with mindfulness, promoting relaxation and mental focus. 3. Physical activity, comma, regular exercise. Engage in aerobic activities like walking, swimming, or cycling to boost mood, improve cognitive function, and enhance overall brain health, comma, strength training. Incorporate resistance exercises to improve physical strength and overall well-being. 4. Healthy diet, comma, balanced nutrition. Focus on a diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. Key nutrients include, comma, omega-3 fatty acids, found in fatty fish, flax seeds, and walnuts, which support brain health, comma, antioxidants. Foods like berries and dark chocolate can help combat oxidative stress, comma, B vitamins, essential for brain health, found in whole grains, eggs, and leafy greens. 5. Adequate sleep, comma, prioritize sleep hygiene. Aim for 7 to 9 hours of quality sleep each night. Establish a calming bedtime routine and create a sleep-friendly environment to enhance sleep quality. 9. Limit alcohol and avoid drugs, comma, reduce alcohol intake. Excessive alcohol can exacerbate PTSD symptoms and impair cognitive function. Avoid recreational drugs that can harm mental health. 10. Practice gratitude and positivity. Gratitude journaling. Write down things you are grateful for to shift your focus toward positive experiences and reduce stress. Conclusion. Improving brain health after experiencing PTSD and TBI without medication requires commitment to healthy lifestyle choices and therapeutic practices. Regularly assess your progress and adjust your strategies as needed. If you find it challenging to manage your symptoms, consider consulting a healthcare professional or therapist who can guide you on your path to recovery. 6. Social support. Stay connected, engage with friends, family, or support groups to foster social connections and combat feelings of isolation. Sharing experiences can be healing. Participate in group activities. Consider joining clubs, classes, or community events that interest you. 7. Engage in mental activities. Cognitive challenges. Keep your brain engaged through puzzles, reading, or learning new skills. Activities that challenge your mind can help improve cognitive function. Memory games. Practice memory-enhancing games to strengthen cognitive abilities. 8. Establish a routine. Daily structure. Create a daily schedule that includes time for activities, self-care, exercise, and relaxation. Routines can provide stability and a sense of purpose. Rehabilitation therapies are specialized treatments designed to help individuals recover from injury, illness, or surgery and to regain or improve their functional abilities. Here's a brief overview of the main types. 1. Physical therapy, PT. This therapy focuses on improving physical function, mobility, strength, and balance. It's often used for recovery from injuries, surgeries, or chronic conditions affecting movement. 2. Occupational therapy, OT. Occupational therapy helps individuals develop, recover, or maintain daily living and work skills. This therapy is particularly useful for people with physical, mental, or developmental conditions that impact their ability to perform everyday activities. Short-term memory loss refers to the inability to retain or recall information that was recently learned or experienced. This type of memory loss affects the brain's ability to hold on to new information for a brief period, typically seconds to minutes. Common symptoms include, forgetting recent conversations or events, for example. A person might forget what they just said or did a few minutes ago. Difficulty remembering where items were placed, misplacing objects, like keys, or a phone soon after putting them down. Repeating questions or statements, asking the same question multiple times without realizing it has already been answered. 3. Speech therapy. Speech-language pathologists provide this therapy to help individuals with communication disorders. It also includes treatment for swallowing disorders and other aspects of verbal and nonverbal communication. Each of these therapies is tailored to the individual's specific needs, often involving exercises, activities, and education to help them achieve the highest level of function and independence possible. Short-term memory loss refers to the inability to retain or recall information that was recently learned or experienced. This type of memory loss affects the brain's ability to hold on to new information for a brief period, typically seconds to minutes. Common symptoms include, forgetting recent conversations or events, for example. A person might forget what they just said or did a few minutes ago. Difficulty remembering where items were placed, misplacing objects, like keys. Short-term memory loss refers to the inability to retain or recall information that was recently learned or experienced. This type of memory loss affects the brain's ability to hold on to new information for a brief period, typically seconds to minutes. Common symptoms include, forgetting recent conversations or events, for example. A person might forget what they just said or did a few minutes ago. Difficulty remembering where items were placed, misplacing objects, like keys, or a phone soon after putting them down. Repeating questions or statements, asking the same question multiple times without realizing it has already been answered. Short-term memory loss can be caused by various factors, including aging, head injuries, stress, lack of sleep, certain medications, or medical conditions like dementia or stroke. While some causes are temporary and treatable, others may require long-term management. Treating short-term memory loss depends on its underlying cause. Here are some general approaches. 1. Medical treatment, comma, addressing underlying conditions, treating conditions like thyroid disorders, depression, anxiety, or infections that might cause memory problems, comma, medication adjustments, if memory loss is due to medications, a doctor may adjust the dosage or prescribe alternatives, comma, cognitive enhancing drugs, for conditions like Alzheimer's disease, medications, such as cholinesterase inhibitors may help slow the progression of memory loss. 2. Lifestyle changes, comma, healthy diet, eating a balanced diet rich in fruits, vegetables, whole grains, and lean proteins can support brain health, comma, regular exercise, physical activity improves blood flow to the brain, which can enhance memory and cognitive function, comma, adequate sleep. Ensuring enough restful sleep is crucial for memory consolidation and cognitive health, comma, stress management. Techniques such as meditation, yoga, or deep breathing can reduce stress, which can impact memory. 5. Environmental modifications, comma, organizing living space. Keeping frequently used items in specific places can reduce the chances of misplacing them, comma, labeling drawers, cabinets, or other storage spaces can help in remembering where things are kept. 6. Social interaction, comma, staying socially active. Regular interaction with family, friends, and community groups can stimulate the brain and improve memory. In cases where memory loss is progressive or severe, ongoing support from healthcare professionals, caregivers, and family members may be necessary. It's important to consult a healthcare provider to determine the specific cause and appropriate treatment plan for short-term memory loss. 3. Cognitive rehabilitation, comma, memory exercises, engaging in puzzles, memory games, or brain training apps can help strengthen cognitive function, comma, routine establishment. Creating a consistent daily routine can help reduce confusion and support memory retention, comma, use of memory aids. Tools like calendars, lists, alarms, and smartphone reminders can help manage daily tasks and remember important information. 4. Therapy, comma, cognitive behavioral therapy, CBT. This can help individuals develop strategies to cope with memory loss and improve cognitive function, comma, speech and language therapy. In cases where memory loss affects communication, speech therapists can help with strategies to improve verbal memory. The effectiveness of medications for short-term memory loss depends on the underlying cause. Here are some commonly used medications based on different conditions that might cause memory issues. 1. For Alzheimer's disease and other dementias, comma, cholinesterase inhibitors. These drugs work by increasing levels of acetylcholine, a neurotransmitter involved in memory and learning. Common examples include, comma, donepezil, Aricept, comma, rivastigmine Exelon, comma, galantamine, Razidine, comma, memantine Namenda. This drug regulates glutamate activity, another neurotransmitter involved in memory and learning, and is often used in combination with cholinesterase inhibitors. 2. For depression-related memory loss, comma, antidepressants. If memory loss is linked to depression, medications like selective serotonin reuptake inhibitors, SSRIs, or other types of antidepressants might help improve mood and, in turn, memory function. Examples include, comma, sertraline, Zoloft, comma, escitalopram, Lexapro, comma, venlafaxine Effexor, comma, bupropion, Wellbutrin. This atypical antidepressant may have a more stimulating effect and could be beneficial if cognitive sluggishness accompanies memory issues. 3. For sleep-related memory issues, comma, melatonin, a natural hormone that regulates sleep-wake cycles. Melatonin supplements can help improve sleep quality, which in turn can enhance memory, comma, benzodiazepines and Z drugs. These are prescribed for short-term use to treat insomnia, which can affect memory. However, they should be used cautiously as they can sometimes worsen memory issues. 4. For attention and focus issues, comma, stimulants, medications used to treat ADHD like methylphenidate, Ritalin, Concerta, or amphetamine, Adderall, can improve focus and, indirectly, short-term memory in some individuals, comma, non-stimulant ADHD medications, atomoxetine, Strattera, can also help with attention and memory. 5. Supplements, omega-3 fatty acids. Some evidence suggests that omega-3 supplements, particularly those rich in DHA, may help support brain health and memory, ginkgo biloba. While the evidence is mixed, this herbal supplement is often used to improve memory and cognitive function. Important considerations, side effects and interactions. Medications can have side effects or interact with other drugs, so it's crucial to use them under a doctor's supervision, non-medication approaches, often, lifestyle changes, cognitive training, and addressing underlying conditions are more effective than medications alone. It's important to consult a healthcare provider to determine the appropriate medication, if any, for your specific situation. They can help tailor a treatment plan based on the cause of the memory loss and any other health conditions you. 2. Cognitive benefits, improved attention and focus. Fast-paced games, like action or first-person shooters, require players to maintain high levels of attention, which can improve concentration and the ability to process information quickly, enhanced problem-solving skills. Puzzle games and strategy games often require planning, critical thinking, and adaptability, which can enhance problem-solving abilities, better spatial awareness. Games that involve navigation, such as adventure or racing games, can improve spatial awareness and visual motor coordination, memory enhancement. Some games, especially those that involve storylines or complex strategies, can help improve memory by requiring players to remember details or patterns. Yes, playing video games can have various effects on the brain, including stimulating both gray matter and cognitive functions. Here's how. 1. Gray matter stimulation, gray matter. This part of the brain is involved in muscle control, sensory perception, decision-making, and other cognitive functions. Video games, especially those that require complex problem-solving, strategy, and quick decision-making, can increase the volume of gray matter in certain areas of the brain. Research findings. Studies have shown that action games, for instance, can lead to increases in gray matter in the hippocampus, important for memory and learning, the prefrontal cortex, involved in decision-making and problem-solving, and the cerebellum, important for motor control and coordination. 3. Emotional and social benefits, stress relief. Many people play video games to relax and relieve stress, which can have positive effects on mental health, social interaction. Multiplayer games and online gaming communities offer opportunities for social interaction, teamwork, and communication, which can be beneficial for mental and emotional well-being. 4. Potential drawbacks, overuse concerns. Excessive gaming can lead to negative effects, such as addiction, reduced physical activity, or impaired social skills. It's important to maintain a balance between gaming and other activities, content matters. The type of game matters. Some games may promote violent behavior or negative social interactions, so it's important to choose games that are appropriate and beneficial. In summary, video games can stimulate gray matter and enhance cognitive functions, including memory, attention, and problem-solving. However, moderation is key, and choosing the right types of games is important for reaping these benefits. The relationship between video games and brain function in individuals with schizophrenia is complex, and research in this area is still evolving. Here's what is currently understood. 1. Gray and white matter in schizophrenia, gray matter in people with schizophrenia. There is often a reduction in gray matter volume, particularly in areas involved in cognitive functions, such as the prefrontal cortex and hippocampus. This reduction is linked to the cognitive and functional impairments associated with the disorder, white matter, which consists of nerve fibers that connect different parts of the brain, can also be affected in schizophrenia. Disruptions in white matter can lead to problems with communication between brain regions, contributing to the symptoms of the disorder. 2. Potential benefits of video games, cognitive enhancement. Video games, especially those designed to improve cognitive functions, often called serious games or cognitive training games, have the potential to enhance cognitive abilities such as memory, attention, and problem-solving. For individuals with schizophrenia, this could help in addressing some cognitive deficits associated with the disorder. Neuroplasticity. Video games might promote neuroplasticity, the brain's ability to reorganize itself by forming new neural connections. This could be beneficial in improving the function of both gray and white matter. Social interaction. Multiplayer and cooperative video games can provide a controlled environment for social interaction, which might help individuals with schizophrenia practice and improve their social skills. In summary, while video games may have the potential to stimulate gray and white matter and improve cognitive function in people with schizophrenia, their use should be carefully considered and tailored to the individual. Collaborating with healthcare providers to choose appropriate games and ensure balanced gaming habits is essential. 4. Limitations and considerations. Type of games. Not all video games are beneficial. Fast-paced or violent games might increase stress or exacerbate certain symptoms, so the type of game is important. Moderation. Excessive gaming can lead to negative outcomes, such as social withdrawal or increased stress, particularly in vulnerable populations. Personalization. The impact of video games can vary greatly depending on the individual. Personalized approaches, possibly guided by a healthcare provider, are likely to be most effective. 5. Current research. Ongoing studies. Research is ongoing to determine the specific effects of video games on brain function in individuals with schizophrenia. Some studies have shown potential benefits in cognitive functioning, but more research is needed to fully understand the mechanisms and long-term effects. 3. Therapeutic use of video games. Cognitive remediation therapy, CRT. This type of therapy uses structured exercises, sometimes delivered through computer-based programs, to improve cognitive deficits in schizophrenia. While not traditional video games, some CRT programs incorporate game-like elements to engage patients. Virtual reality, VR games. VR-based interventions are being explored as a way to help individuals with schizophrenia practice real-world skills in a safe and controlled environment.